Cash practice physical therapy is somewhat of a new trend in physical therapy settings. It's very different from the physical therapy mill in that the focus at a cash practice is always with the patient. It's very heavily based on one-on-one care, really tailoring the care that the patient receives to what it is that the patient feels is their greatest outcome possibility. In a physical therapy mill, many times you're seen in conjunction with 3 or 4 other patients. You may be moved around the room by less skilled practitioners, maybe like there's physical therapy aides or techs, and those, while they mean well, may be educated at a high school or collegiate level. They may aspire to one day be physical therapists, but they're truly not the professionals that should be guiding your care. In a cash practice, you can expect to have a very, very comprehensive evaluation, be able to ask all the questions that you need to ask, get the information that you sought, and then your care will be tailored toward your goals. So you'd come in, you'd pay cash, whatever it was that the physical therapist setting would charge for their treatment. A lot of times, the physical therapy setting will also set aside documentation so that that patient can seek reimbursement from the health insurance. And again, the focus would be on patient outcomes and the best care that can be delivered for that patient and client. Patients benefit from cash physical therapy practice because they can be sure that the care that they get is going to be specifically focused on their individual needs, a very comprehensive approach, and will be based on the outcomes that the physical therapist and the patient are really desiring. It doesn't mean that a physical therapy clinic that operates in this way is more expensive. It's differently expensive. Going to a physical therapy mill where you had to pay a $20 or $30 copay for long, protracted treatments, mostly because they're ineffective or they're not spending enough time in treatment, can be just as expensive or more than being seen at a cash practice, having that focused care, and then being done with physical therapy in a rapid manner. Absolutely not. All of the patients that we see at SPARK Physio pay for their service at the time of their service, and then we will almost always submit that claim for them as out-of-network providers, and they receive the reimbursement which they're entitled to. It's a little different setup in that you're paying for service on the front end and then receiving the benefit from it, and then receiving a reimbursement on the back end from that health insurance provider. But to say that you can't use your health insurance is absolutely not the case. In a lot of cases, many physical therapy clinics that operate this way have great systems in place to help their patients seek reimbursement, as well as sometimes do it for them like we do here at SPARK Physiotherapy. There are lots of questions that a patient might ask, one of which is always how much time will be spent in treatment. Now, if you're seeking the care of a cash practitioner, it's very likely that you're going to have lots of time with the therapist in treatment to ask questions, to receive manual care, to get education on therapeutic exercise, or whatever it is that the physical therapist finds are the really important points of your all-the-way well care. You might ask if there is any specialty that therapist provides, whether it's work with a specific kind of athlete or a specific kind of mover. There are lots of therapists who specialize in work with musicians, for example, or work with baseball players, work with soccer players, or work with horse jockeys. I mean, there are many different kinds of places that a physical therapist can go and be specialized. So if these are concerns that you might have, certainly ask those questions. Also, you might ask whether or not there are systems in place so that the patient can seek their own reimbursement from their health insurance. Many do have systems in place, and almost all are seen as out-of-network providers by health insurance. And in our case at SPARK Physio, we have a system where a lot of our clients will submit, or we will submit the claims for them, and they see reimbursement to the tune of up 50 to 60% of their care. And so in the long run, it doesn't wind up being any more expensive, but certainly the care that they get is richer, and the benefits that they receive are more than in a physical therapy mill.